Since taking office, one of the things that I've had to grapple with is the role and limitations of local government. We're seeing, as residents continually tell me, taxes are too high. And I think what they're really saying is you can't just keep taxing your way out of problems. And I think that's come through very loud and clear, not only in North Tonawanda, but beyond. And so how do governments adapt? How do they get into the 21st century and correct some of the unsustainable costs and mandates or what have you that are there? And I think that goes to the larger question of what is the role of local government? What should residents expect? And what are those priorities? And we're going to have to learn to budget around those priorities. And if it's not a priority for the community as a whole, it may have to do with less funding, or even we may have to find some other way, whether it's through consolidation or privatization, to deliver that service, because the government no longer can, the taxpayers no longer can share the burden of that cost. One of the issues that I've tackled or that I've looked at and that it is driving costs up in North Tonawanda are our healthcare benefits and healthcare plans for our city workers. Our city workers are professional. They work very hard. Many of them live in the city of North Tonawanda and are taxpayers themselves. The question becomes, though, the costs that we are currently funding are not sustainable in the long term. Many of our workers today will be retired in 10, 15 years and will be paying still lifetime hospitalization, lifetime medical. Of course, those are costs that will continue to rise that we have no control over. The city of North Tonawanda, nor the residents, nor even the employees have control over medical costs and what the insurance carriers will do, federal legislation, all those kinds of things. But we do know that those costs are likely to continue to increase. Given that we know that, we have to take measures to reduce the taxpayer share of those healthcare costs. I have residents that can't afford healthcare for their families, and yet they are paying for healthcare for someone else's family that is much beyond what they would ever be able to even think about affording. Is that right? Is that fair? I would say no, it's not fair.